I'm Dr. Michelle Kraskin, Assistant Director of the Hearing and Speech Department at Weill Cornell Medicine in New York City. When we have patients who have either single-sided deafness, microtia atresia, unilateral hearing losses, especially for the little ones, we often recommend a Baha Softband. So we've run into issues with the older children where they no longer want to wear the Baha Softband and they're not yet appropriate for surgery if the families even want to choose that as an option. Some of my children have structural abnormalities where families are just focused on that. And so to have an option that's more discreet and safer for them to wear, easier for them to play around with, jump around with, and be less visible, it's something that families are really accepting of. I've found an increase of patient acceptance of our recommendations when we've offered the Baha SoundArc. So the Baha SoundArc is almost like if you imagine a headband worn behind your head, and the processors can attach on either side, so it could be for a single-sided or for a bilateral patient. There's a metal retainer disc which helps with the appropriate placement and pressure so that you're not losing any of that sound quality when you're going from a Softband to the SoundArc device. Depending on what size you are, how big your head is, or if you've got 1 ear or 2 ears, we can make it work for you. It's quite comfortable. The silicone grips at the end help it keep in place. So I believe he's about 8 years old, a little boy, and I asked him, can you jump around in it? And his question was, why wouldn't I be able to jump? So I found with our patients, they can do anything that they could do with the Softband now with the SoundArc. With the SoundArc, we are able to have patients wear it, take it home. It's more discreet, and that they don't have to address it with their coworkers. Kids don't have to tell their friends if they don't want to. In terms of the demoing in the office, it's also made it easier for us as a clinician because it looks a little bit more modern, especially with the newer processors and what's out there. It's an easy to fit, easy to adjust, easy to manipulate. A lot of our patients find that having another wearing option is particularly helpful for them. So in our center, we have a lot of children with microtia atresia, both single-sided and bilaterally. One patient in particular I can think about, she's worn a Baha Softband since she's about 2 to 3 months of age. And when we presented her with the SoundArc, she was happy she has another way to wear her hair. So she's worn her hair in sort of a headband way, and she was excited she could put her hair back in a ponytail, or she could put her hair down and that nobody would see it, and she could still hear. I've had other patients who are very resistant, I think she's 10, who was very resistant to wearing anything, was embarrassed. Her mom didn't want to tell anybody that she had this hearing loss. And when we presented her with the SoundArc, she actually said Christmas came early this year. And mom cried, and the child has worn it every day since. And this was somebody who, up until the age of 10, refused to wear any type of amplification. In terms of sound quality, I think it's important when counseling your patients that they should appropriate placement and appropriate force and tension. There should not be a difference between the Softband and the SoundArc. We've found when patients have actually reported that there's a difference in sound quality or they're not hearing quite as well, I've asked them to send photos, and we've noticed that the proper placement was not being instituted at home. So I think that's a key thing when you're talking with your patients. You want to make sure that they're always wearing it the right way. Try it out. Really, it's as simple as just put it on, try it yourself, and you'll see the difference immediately. Patients will notice the difference immediately.